Alright, this is the heart examination. So first off, I'm going to check for the general appearance for the hands and nails, and then check nail beds for cardiopulmonary disease. And then, or that would be nail clubbing, would be indicative of lung and heart disease. So I'm going to check now for jugular venous pressure. So I'm going to have the patient look up to the right, and I'm going to check for the highest spot that I can feel. And then I would put it at the angle of one ruler at the angle of Louis. And then I put the other as high as I can feel it, and it should be around 2 to 3 centimeters. And it is. And then I would then move on and observe the chest for asymmetry and deformity, and basically checking for difficulty in breathing while just asking the patient to take normal breaths. Then I would go and I would check the apical impulse. So I would take a pen light, which I don't have, and I would shine it across the region of the left ventricle, and I would ask the patient to exhale slowly and hold their breath at the end of expiration. So hold there. Yep, and I can see the apical impulse. So now I'm going to check for the point of maximum intensity. So I palpate. Oh yeah, I just feel for the just palpate for the apical impulse. Feel it there. So now I'll move on to auscultation, and I will start with the diaphragm, and I would listen for thrills at the aortic. I'll listen for thrills at the aortic. Oh, excuse me. I would palpate for thrills at the aortic and at the pulmonary and at the tricuspid and the mitral valve. And then I'd move on and do percussion. Yeah, so basically listening for resonance and dullness. Alright, yeah, and just basically listening for the borders of the heart. Yeah, so I'm going to ask the patient to be seated for this portion. So have you sit up. So I would use a diaphragm for this. I'd ask the patient to, just to breathe normally, and I'd go for all the heart positions. So the aortic, the pulmonic, Erb's point, tricuspid, and mitral. And basically I'm listening for extra sounds or murmurs. Yeah, and then I would also check with the bell over the same positions. Yeah, so now I'd move on to aortic regurgitation evaluation. So I'm going to ask the patient basically to lean forward for me, and I'm going to listen to, basically listen to their heart. And just make sure there's not a lub pew sound. So I'm going to ask the patient to exhale completely and then hold the breath and bear down at the end of it. And, yep, sounds normal. And I'll move on to mitral valve enhancement. Oh yeah, basically within those exams, I listened for that during the initial aortic regurgitation evaluation. And I think that concludes the Okay, yeah, I'm going to ask the patient to lie down again at a 45-degree angle. And then I will put the bell. Yeah, and then, so I'd put the bell over the mitral. And then I would ask them to breathe completely all the way out and then bear down. And that's listening for mitral valve prolapse murmur. And that concludes the heart.